Is an extension with those abortion restrictions better than no extension at all?
An extension with abortion restrictions kills women. So no, I'm not going to allow this Republican majority to kill women in this country so that they can try to do whatever their victory lap is. I will not accept women and the lives of women as some political cost for them being able to extend these things. Reproductive care is health care, period. We're not going to do this thing where we say, people can get health care, but women can't, or people from this geographic place can't, or that geographic place can't. We need to legislate as Americans.
Did you hear what she just said? Because you need to understand exactly what is happening here in this moment, and why this single exchange represents the absolute moral frontier of American politics right now. The precise battleground where the soul of this democracy hangs in the balance, while Republicans literally extort basic health care from working families to advance their depraved crusade against reproductive freedom. Senate Republicans are demanding stricter abortion restrictions on insurance plans as the price for extending Affordable Care Act funds set to expire at the end of this year, with the pressure campaign led by Susan B. Anthony Pro-Life America threatening to score votes against any Republican who supports a clean extension. We are watching in real time as subsidies expire at the end of 2025 and are expected to cause prices to skyrocket for more than 20 million Americans who depend on these credits to afford health care. And the Republican Party has decided that this crisis, this genuine emergency affecting millions of families, represents their golden opportunity to smuggle through a backdoor national abortion ban that would obliterate reproductive rights even in states where abortion remains legal. Alexandria Ocasio-Cortez stands there and declares without equivocation that an extension with abortion restrictions kills women, and she is speaking literal scientific truth because we now have the data, we have the research, we have the bodies piling up in states with abortion bans, and the evidence is absolutely undeniable. Women who lived in states that ban abortion were significantly more likely to die during pregnancy or soon after birth, with the maternal mortality rate in banned states for Black women reaching 60.9 maternal deaths per 100,000 live births, significantly higher than rates for white or Latina women. When AOC says these restrictions kill women, she is not engaging in hyperbole, she is not being dramatic for effect, she is channeling the voices of 59 excess deaths from an 8% increase in pregnancy-associated mortality, a 50% jump in the sepsis rate among women who lost their pregnancies in the second trimester in Texas. And the stories of Amber Thurman, and Jocelyn Barnica, and Neva Ekrane, and Candy Miller, women who died because abortion bans prevented them from accessing timely medical care. This is not theoretical, this is not abstract political philosophy, this is blood and death, and the systematic destruction of women's bodies on the altar of Republican ideology. And here is what makes this moment so spiritually grotesque, so morally repugnant, that it should shake every person of conscience to their core. Republicans demanded language adding new limits for abortion coverage that were a red line for Democrats, even though an existing law explicitly prohibits using federal premium tax credits from funding any abortion services, with limited exceptions for when the life of the woman is in danger or in cases of rape or incest. The Hyde Amendment already applies, the restrictions are already in place, but that is not enough for these theocratic extremists because Republicans want to block states from allowing people to access abortions through the Affordable Care Act marketplaces, using state or other funding, which means they are weaponizing federal healthcare policy to override state sovereignty and impose their abortion absolutism on blue states that have chosen to protect reproductive freedom. What Republicans are talking about putting on the table amounts to nothing short of a backdoor national abortion ban, as Senator Ron Wyden correctly identified, because once you establish the precedent that the federal government can eliminate abortion coverage from any insurance plan that touches federal subsidies in any way, you have effectively nationalized abortion restriction through the healthcare system itself. Just yesterday, literally yesterday, both bills needed 60 votes to advance, but neither succeeded, with the Republican-backed plan failing by a vote of 51 to 48, as Democrats rejected the bill, arguing it did nothing to address health care premiums and opposed restrictions in the bill on abortion and gender-affirming care. The Republican alternative was an insult, a mockery, allowing the ACA tax credits to expire, and instead approving new funds to boost health savings accounts for Americans up to 700% of the poverty level, with eligible adults under 50 receiving $1,000 per year, and those 50 to 64 receiving $1,000, which would be completely insufficient when deductibles for those plans average around $7,000. This is not a healthcare plan. This is a cruel joke. This is Republicans saying we will give you $1,000 to cover a $7,000 deductible. And by the way, you cannot use any of it for abortion or gender-affirming care because we are going to control your medical decisions with ideological handcuffs. And now, premiums will double, on average, for more than 20 million Americans, because Republicans would rather watch healthcare costs explode for millions of families than allow women in California or New York or Illinois to maintain access to comprehensive reproductive care. Listen to what AOC says in that clip about not accepting women and the lives of women as some political cost for Republicans being able to extend these things and take their victory lap, and understand that she is articulating the fundamental moral framework that should guide every progressive in this country, because women's lives are not bargaining chips. Reproductive freedom is not a negotiable commodity to be traded away in legislative horse trading. The GOP has calculated with cold precision that they can exploit this healthcare crisis as leverage, that they can hold millions of people's premiums hostage to extract concessions on abortion, and they are betting that Democrats will eventually cave because the pressure will become unbearable when families start seeing their insurance costs double in January. But AOC is drawing the line. She is saying, no, we will not participate in this extortion. We will not collaborate in the construction of a national abortion ban, even if Republicans are willing to burn down the healthcare system to get it. And the research keeps pouring in, the evidence keeps mounting, the death toll keeps rising in states where abortion has been restricted or banned. Researchers estimate 22,180 more live births and 478 more infant deaths than expected across 14 states that banned abortion, with Black infants dying at a rate 11% higher than would have been expected. Maternal death rates in abortion restriction states were 62% higher than in states with greater abortion access, at 28.8 versus 17.8 per 100,000 births. One study estimates a total abortion ban in the United States would result in an additional 140 maternal deaths annually, a 21% increase in maternal death, and a 33% increase for non-Hispanic Black individuals. Every single one of those statistics represents a human being, a person with dreams and family, and a future that was stolen from them because Republican legislators decided that ideological purity on abortion matters more than women's survival. When AOC says an extension with abortion restrictions kills women, this is what she means. This is the empirical reality she is naming. The sheer audacity of the Republican position here should take your breath away, because they are literally arguing that taxpayer dollars are funding abortion through the ACA, when that is demonstrably, provably false, when the law already contains explicit prohibitions, when states that allow abortion coverage through marketplace plans require enrollees to pay a separate fee precisely to comply with federal restrictions. States with insurance plans that offer coverage for abortion services charge enrollees a separate fee to cover costs, and the total amount collected also exceeds the cost of abortion services in the states. But truth does not matter to these people. Facts do not penetrate their ideological armor, because the goal is not actually to prevent federal funding of abortion, since that is already prevented. The goal is to eliminate abortion access everywhere by any means necessary, and they have decided that healthcare extortion is their vehicle. Recent reports indicate that Republican members of Congress are attempting to tie their support for extending the tax credits to a ban on abortion coverage in all state ACA insurance plans, with congressional Republicans only willing to extend the ACA subsidies in exchange for harsher abortion restrictions. Now fast forward to what happened in the Senate just yesterday, and witness the complete breakdown of anything resembling functional governance or good faith negotiation. Republicans and Democrats never engaged in meaningful or high-level negotiations on a solution, even after centrist Democrats struck a deal with Republicans to end the shutdown in exchange for a vote, as the deal raised hopes for a compromise on health care, but that quickly faded with a lack of any real bipartisan talks. The Republicans never had any intention of compromising. They were simply running out the clock, creating artificial crisis conditions to maximize their leverage, while millions of Americans watched their healthcare costs spiral into uncertainty. And when the votes finally came, Democrats proposed a 3-year extension of the enhanced ACA subsidies, which failed in a vote of 51 to 48, though several Republican senators crossed the aisle to join all Democrats in supporting it, proving that even some Republicans understand the catastrophic harm that will result from letting these subsidies expire, but not enough to overcome the anti-abortion extremists who control their caucus. The Congresswoman says reproductive care is health care, period, and that simple declarative statement contains within it an entire philosophy of bodily autonomy and human dignity and medical reality, because abortion is health care, contraception is health care, miscarriage management is health care, and you cannot separate reproductive care from the broader healthcare system without creating a tiered system where women receive substandard treatment and doctors are forced to watch their patients deteriorate, while calculating legal risk. We are already seeing this nightmare play out in red states where pregnant women have bled to death, succumbed to fatal infections, and wound up in morgues with what medical examiners recorded were products of conception still in their bodies. Yet panels in states that have recently imposed strict bans on abortion have done little to uncover whether the laws are contributing to maternal deaths. The maternal mortality review committees that are supposed to investigate these deaths and prevent future tragedies have been systematically undermined in states with abortion bans because political leaders who backed the bans have stood in the way of measuring their consequences and have dismissed committees, slowing down their work. This is what AOC means when she says she will not allow this Republican majority to kill women in this country, because allowing Republicans to attach abortion restrictions to ACA subsidies would be allowing them to export the deadly conditions of Texas and Mississippi and Oklahoma to every corner of America. It would be normalizing and institutionalizing the principle that healthcare can be conditioned on reproductive control, that the government can use its spending power to eliminate abortion access even where state law protects it, that women's lives are acceptable collateral damage in the culture war, and once you accept that framework, once you concede that ground, there is no limiting principle, there is no firewall, because if Republicans can ban abortion coverage in ACA marketplace plans, they can ban it in Medicare, they can ban it in the Veterans Administration, they can ban it everywhere the federal government touches healthcare, which is essentially everywhere. The tactical genius of what AOC is doing in this clip is that she refuses to engage with the false premise of the question. She will not participate in the framing that suggests abortion restrictions are a reasonable compromise position or an acceptable cost of doing business. When asked whether an extension with abortion restrictions is better than no extension at all, she does not hedge, she does not equivocate, she does not perform the studied moderation that so many Democrats fall back on when discussing reproductive rights. She says plainly that such an extension kills women, and therefore the answer is categorically no. This is how you defend fundamental rights. This is how you prevent the ratchet from clicking another notch to the right, by refusing to normalize the premise that women's health care is negotiable, or that abortion restrictions are just another policy option, rather than instruments of death and control. And make no mistake about the forces arrayed behind this Republican extortion campaign, because the push is a pressure campaign by Susan B. Anthony Pro-Life America, an influential group fighting to ban abortion in the U.S. per site, whose president told senators that a vote for this extension is a vote for abortion coverage, and that votes will be scored and double-weighted in each member's profile on their national pro-life scorecard. This is not grassroots concern about healthcare costs. This is not authentic fiscal conservatism. This is the anti-abortion movement deploying its considerable political muscle to blackmail Republican legislators into opposing healthcare subsidies, unless they extract maximum restrictions on reproductive freedom. The tail is wagging the dog, the extremists are setting the agenda, and the result is that more than 20 million Americans face major premium hikes, and some people insured under Obamacare could see their bills rise by thousands of dollars per month, raising concerns that millions will choose to go uninsured. Think about the breathtaking cruelty of that outcome. Think about the human cost of what Republicans are engineering here. Families will be forced to drop their health insurance because they cannot afford doubled premiums, which means delayed cancer screenings and untreated diabetes and heart conditions that spiral out of control, which means medical bankruptcy and untreated pain and preventable deaths from causes that have nothing to do with abortion, but everything to do with Republican willingness to sacrifice public health on the altar of reproductive control. More than 9 million Republicans and Republican-leaning independents depend on Obamacare for their health insurance, which means the people who will suffer most acutely from the expiration of these subsidies include millions of Republican voters in red states, but the anti-abortion absolutists who control the party have decided that ideological purity matters more than the well-being of their own constituents. AOC says we need to legislate as Americans and we need to legislate for this country, refusing the geographic and demographic carve-outs that Republicans propose, the idea that some Americans in some states deserve comprehensive health care, while others can be left to die because they happen to live in places where Republicans control the legislature. This is the language of universalism, of solidarity, of genuine democratic citizenship that transcends the artificial divisions Republicans exploit to maintain power, and it stands in stark contrast to the Republican vision of healthcare as a privilege to be rationed based on geography and ideology and reproductive status. The Affordable Care Act, for all its flaws and limitations, represented an aspiration toward universal coverage, toward the principle that healthcare is a right, not a commodity, And what Republicans are doing now is systematically dismantling that aspiration brick by brick, while using abortion restrictions as the crowbar. And here is what makes this moment so urgent, so consequential, so potentially catastrophic. This was the unceremonious end to a months-long effort by Democrats to prevent the COVID-19-era subsidies from expiring on Jan 1, including a 43-day government shutdown that they forced over the issue. The clock has run out. The subsidies will expire in less than 3 weeks unless something dramatic changes, and there's a Dec. 15 deadline to pick an insurance plan on the ACA marketplace to ensure coverage starts at the beginning of 2026, meaning households are in limbo and unsure how to plan financially. Millions of Americans are trying to make healthcare decisions right now without knowing what their premiums will be, without knowing whether they can afford to maintain their coverage, and Republicans are treating this crisis as a political opportunity rather than a moral emergency that demands immediate action. In the House, Speaker Mike Johnson has promised a vote next week on some type of healthcare legislation, though Republicans weighed different options in a conference meeting with no apparent consensus. Which means even now, even after yesterday's failed Senate votes, even with the deadline looming, Republicans still have not coalesced around any plan to prevent premiums from doubling, because significant factions of their caucus actively want the subsidies to expire. They want Obamacare to fail. They want the healthcare system to collapse. They want to create conditions of maximum chaos and suffering that they can then exploit to push through their long-desired overhaul that would gut coverage protections and eliminate abortion access, and return us to the pre-ACA hellscape where insurance companies could deny coverage for pre-existing conditions and lifetime limits could bankrupt families dealing with serious illness. This is why AOC's moral clarity in this moment matters so profoundly, why her refusal to accept the false choice between healthcare subsidies with abortion restrictions, or no subsidies at all, represents the kind of principled resistance that progressives must embody if we are going to prevent the complete destruction of reproductive freedom in this country. Because once you accept that abortion rights can be sacrificed to preserve other healthcare benefits, you have conceded the entire game. You have granted Republicans the leverage they need to eliminate abortion access through 1,000 cuts, while Democrats stand by wringing their hands about pragmatism and political reality. The fight for healthcare and the fight for reproductive justice are not separate struggles that must be balanced against each other. They are inseparable dimensions of the same struggle for bodily autonomy and human dignity, and any politics that treats them as competing priorities has already lost. The data shows us with brutal clarity what happens when abortion is restricted or banned. For every major racial or ethnic group, maternal death rates are higher in abortion restriction states compared to abortion access states, including 20% higher among non-Hispanic Black people, 33% higher among non-Hispanic white people, and 31% higher among Hispanic people. The disparities are staggering. The racial dimensions are impossible to ignore, because Black mothers living in banned states were more than 3 times as likely to die as white mothers in those states, with Black maternal mortality 234% higher than white maternal mortality in the banned states. This is not incidental. This is not unfortunate collateral damage. This is the predictable and predicted outcome of policies that restrict abortion access, and it represents a massive regression in public health that is literally killing people in real time. And what makes the Republican position so especially galling, so morally bankrupt beyond measure, is that they are demanding abortion restrictions as the price for extending subsidies while simultaneously refusing to address the maternal health crisis that abortion bans are creating. They want more restrictions, more control, more surveillance of women's reproductive decisions, but they are not proposing increased funding for maternal health services or expanded Medicaid coverage or investments in the healthcare infrastructure that might actually improve outcomes. States that have banned, are planning to ban, or have otherwise restricted abortion have fewer maternity care providers, more maternity care deserts, higher rates of maternal mortality and infant death, especially among women of color, higher overall death rates for women of reproductive age, and greater racial inequities across their healthcare systems. The states with the most restrictive abortion laws are the states with the worst healthcare systems and the highest maternal death rates. And rather than addressing those systemic failures, Republicans want to export that deadly model to the entire country. When AOC says she will not accept women and the lives of women as some political cost, she is channeling the rage and grief and moral urgency that every person who understands these stakes should be feeling right now, because we are watching a political party engineer a public health catastrophe in slow motion. We are witnessing the deliberate construction of conditions that will kill women, and the mechanism they are using is healthcare policy. The leverage they are exploiting is the desperation of families who need affordable insurance, and the victims will be disproportionately poor women, women of color, women in rural areas, women who are already most vulnerable to the failures and cruelties of the American healthcare system. This is structural violence, this is state-sanctioned harm, and it is being perpetrated under the banner of fiscal responsibility and religious freedom, and states' rights and every other euphemism Republicans deploy to disguise their war on women's autonomy. The Congresswoman's voice in that clip carries the weight of someone who understands exactly what is at stake, who has looked at the data and heard the stories and grasped the magnitude of the catastrophe that Republicans are attempting to engineer, and who refuses to be complicit in normalizing that outcome. This is what leadership looks like. This is what moral courage sounds like. This is the voice of someone who believes that politics should be about protecting people rather than sacrificing them to ideological abstractions or partisan advantage. And every Democrat, every progressive, every person who claims to support reproductive freedom or healthcare access or basic human dignity should be taking notes and finding their courage and preparing to fight with everything they have to prevent this nightmare from becoming reality. Because if Republicans succeed in attaching abortion restrictions to ACA subsidy extensions, if they establish the precedent that reproductive control can be wielded as a condition for healthcare benefits, then there is no limit to how far they will push, no restriction they will not attempt, no surveillance they will not impose. They will go after contraception next, they will target IVF, they will criminalize traveling across state lines for abortion care, they will prosecute doctors and patients, and anyone who assists women in accessing reproductive health care, because the endgame has always been total control over women's bodies and reproductive capacity, and they are using the healthcare system as their weapon of choice, because healthcare is where people are most vulnerable, where their desperation for access can be exploited as leverage, where the government's spending power can be converted into mechanism of ideological enforcement and patriarchal control. So when you hear Alexandria Ocasio-Cortez say that an extension with abortion restrictions kills women, understand that she is speaking literal truth grounded in exhaustive research and lived reality. When she declares that she will not allow this Republican majority to kill women in this country, recognize that she is drawing a line that cannot be crossed without betraying everything progressives claim to stand for. When she insists that reproductive care is healthcare period, acknowledge that she is articulating the fundamental principle that must guide our politics if we are going to build a society where people can live with dignity and autonomy and freedom from state-imposed reproductive coercion. This is the fight. This is the moment. This is the moral test that will define whether Democrats have the courage to defend fundamental rights even when doing so carries political risk or requires accepting short-term losses to prevent long-term catastrophe. The subsidies are expiring in less than 3 weeks. Millions of families are facing doubled premiums. The healthcare system is teetering on the edge of crisis, and Republicans are holding all of it hostage to their anti-abortion crusade. But AOC is showing us the path forward, modeling the kind of uncompromising principled resistance that this moment demands, refusing to participate in the normalization of reproductive control as just another negotiable policy preference. We need more of that moral clarity, more of that courage, more of that willingness to name exactly what is happening and refuse to be complicit in it, because the alternative is a future where abortion access has been systematically eliminated through 1,000 different policy mechanisms, where women's bodies are treated as state property to be regulated and controlled and punished, where healthcare is a privilege conditioned on reproductive submission, and where the deaths that result are dismissed as acceptable collateral damage in the culture war. That future is not inevitable. That future can be prevented, but only if we fight with the same moral clarity and uncompromising principle that Alexandria Ocasio-Cortez demonstrated in this moment. The lives of women depend on it. The future of reproductive freedom depends on it. The soul of American democracy depends on it.